right now we're going to be talking about the ECG or the EKG waveform. Each little dip, line, dot represents something that's going on in the heart. Here we're dealing with electricity. So when we're looking at the ECG waveform, what we're looking at essentially is a map of the heart's electrical activity. And I'm going to go over two different waveforms just so you can see a small difference. The first one's going to be normal sinus rhythm, and then the second one's going to be when the electricity starts on the AV node, and I'll get into more detail on that in just a second. So the standard ECG waveform looks a little something like this. And you have your P, Q, R, S, and T. Your P wave is your complete atrial depolarization, electricity going through the atrium. Your QRS complex, again, is electricity, but through the ventricles. So it is ventricular depolarization, electricity going through the ventricles and making them contract. And then your T wave is ventricular relaxation. So what does all that mean? You know, you have your basic waveform, and everyone asks me, how do I understand what the different waveforms mean? Know what the normal is. If you understand what is normal, if you see it and you know why the P wave is upright, why the QRS complex looks the way it does, you will understand what is abnormal. If we draw the heart, we have our right atrium, right ventricle, left atrium, left ventricle. Electricity for the P wave starts here. This is known as the SA node. All normal rhythms start at the SA node. SA node has a rate for electrical discharge at 60 to 100 discharges per minute. That is 60 to 100 beats per minute. Here we have our AV node. Our AV node acts like a regulator. As a stopper, it stops the electricity. So here we have the electrical discharge from the SA node, which makes the ventricles contract, the atrium contract. And right here, we have a pause, a small little flat line. Everyone knows what the flat line is. You hear it on TV, the movies, all that good stuff. It's just that line. No electrical activity in the heart is occurring. Once the ventricles are ready to contract, to push blood out to the lungs and to the body, the AV node releases that electricity, getting the ventricles to contract. Now it does go down the bundle of His into the Purkinje fibers. That's in the anatomy and physiology section. But your SA node is the heart's natural pacemaker, 60 to 100 BPM. Your AV node, if for whatever reason the heart gets injured, the SA node gets injured and stops firing, your AV node can act like a backup pacemaker, but your AV node SA node being your sinus atrial node or sinoatrial node, AV node being your atrial ventricular node. Why? Because it is somewhere in between the atrium and the ventricles, usually sitting right on top of the ventricles. That can fire at 40 to 60 beats per minute. And what that would look like, let's just say for a second, the SA node got injured. So now you have the AV node making an inverted P wave. Why is it inverted? because when we're dealing with positive deflections, it's electricity going towards the electrode. Now, we're dealing with the electricity, instead of coming from up here, no, it's going up in a retrograde direction, backwards, and then going back down. Purkinje fibers. Your Purkinje fibers, which are located inside the ventricles, fire at 20 to 40 beats per minute. So, SA node equals 60 to 100 AV, which would give you the inverted PQRS, or the inverted P wave. 40 to 60. Purkinje fibers, I'm just going to abbreviate it as PF. 20 to 40 beats per minute. If it's just the Purkinje fibers firing off on their own, you are going to see something that may look like that. Why? Because they are located inside the ventricles, and inside the ventricles, all you have is that complete ventricular depolarization, that QRS complex, over and over and over and over again, just like the Energizer Bunny.